So we're here today to talk about giving blood back to patients in the setting of a lot of the procedures that we do where there's a large volume of blood that's removed, typically with particulate matter, that we need to filter that particulate matter out and then give blood back to patients. We all know how important it is to make sure we minimize blood loss during our procedures, minimize the consequences of the anemia that can result, and more importantly, minimize the risks and the consequences of giving blood transfusions back to patients. One of the techniques that we found to be helpful with that is the use of these filters made by Hemonetics that are typically used for the infusion of gravity-fed blood in a high flow capacity during transfusions for these patients. This is the SQ40 filter, this is the orange one. It's a 40 micron filter, and this is the one that we're going to talk about. This is outside of the scope of the indication for the use of this filter though, so I want to be mindful of that as we're talking about how we use this in our practice. We typically will take an 11 or 12 French sheath, we'll insert it into the large end of the filter, make sure that we have a nice snug fit, and then we'll start with a flush of the filter of about 60 cc's of saline to make sure that the filter is then prepped and ready for our procedure. So once we have prepped the filter with the 60 cc's of saline, we're now ready to filter blood in order to give it back to the patient. So now what we do is, after we've removed all the blood from the patient that we want in a particular pass, we have it in a bowl here. It may have particulate matter in it. Sometimes people will do an initial filtering of that by passing it through a towel up front. I find that's not typically necessary in this context of using this filter. So now you've got your bowl with the particulate matter and the blood. You can simply use the syringe and remove the blood from the bowl. Connect it again to your filter and do a slow push through. Again, because this is intended as a gravity-fed filter, we don't want to push too hard and force things through that ought not to go through. This is a 40 micron filter. So we're just slowly pushing this through, getting it into the second bowl, which now has our filtered blood in it, and now we're ready to give that blood back to the patient. Again, it's worth noting that we typically want our ACTs in that 250 to 300 range, but now we can give this blood back in this bowl to our patient through some sort of a venous access, whether that's a venous sheath or an IV.